So this is a management problem. It is not a problem with our frontline workers. Our frontline workers need to be supported.
As Premier Danielle Smith vows to make good on her promise for healthcare reform Tuesday, from firing Alberta Health Services leadership to a promise to terminate the Chief Medical Officer of Health's contract when asked about the staffing crisis.
A lot of that problem was created by policies at Alberta Health Services of having mandatory vaccinations.
I think that a lot of people are concerned with her using AHS and Dr. Hinshaw as a scapegoat for some of the government's own bad decisions during COVID.
Professor Lorianne Hardcastle disputing Smith's comments that AHS COVID vaccine mandates significantly impacted staffing. Approximately less than 3% of healthcare workers were impacted by the policy that ended this summer.
Every single scientist and public health expert knows that science is a process, not a list of facts.
The Canada Research Chair in Health Law and Policy is pointing out scientific advice has evolved from when vaccine mandates were brought in.
And she is playing to misinformation. She seems to be embracing the misinformation that surrounds vaccines to fulfill a particular agenda. And I find that fantastically frustrating from someone who's supposed to be a leader.
When asked where healthcare staff could come from, Smith pointing the blame to AHS.
Going to keep focused on being able to provide that care and supporting our staff and physicians to be able to do so.
The AHS Chief Edmonton Zone Officer stressing Wednesday staffing was an issue before the pandemic.
You know, opportunity for looking at different ways of being able to deliver services is always part of what we do.
Something being worked on, along with solutions to the healthcare crisis. And a Canadian Tire renovated into a health hub in North Edmonton is an example of the primary care network and AHS working together to meet people where they're at. It took 5 years to get this Northeast Edmonton facility, bringing family doctors, home care, and mental health services under one roof to keep people from needing emergency care.
I think change is necessary. I think there's many gaps in the system, but I think just as this example of the community health hub shows, we can work together to find solutions.
Smith says she does plan to meet with nurses unions and medical associations as those in healthcare wait to see what is just political talk and what will actually happen to healthcare in Alberta. In Edmonton, Carly Robinson, City News.